So what are some of the most recent trends that we're seeing in terms of illicit drugs here in Southwest Wisconsin, specifically as it pertains to opioids and meth?
So we've kind of seen an influx of meth tremendously within the last couple of years. But interestingly enough, last night we actually had a heroin overdose here in Grant County. So heroin is still here. It's not as prevalent as meth. I mean, meth has really surged quite a bit. It's coming, from the Twin Cities area down into our area, and we've seen quite a bit more of it in our inmate population. A lot of times they'll be using meth and do other crimes and wind up, in our facility. But our patrol deputies have seen it as well, and our social services department has seen a big spike in their out-of-home placements coming from meth user homes.
And can you talk a little bit about what law enforcement is doing, partnering with local hospitals, social services to try and combat these trends?
Sure. So we became partners with social services through the Drug Endangered Children program, where we work with them. We go out to houses with them if there's suspected drug use in children in the home. Obviously, we conduct a different type of investigation, but along with them as they do theirs. And we've done a couple of them recently, and they've been successful to get children that they help that they need, and so forth. So, and that program then encompasses other community partners as well.
You mentioned during the panel that it's not so much that we have a meth problem as we've got a pain problem.
Right, yeah, that was through a discussion with one of the professors here at UWP, and he kind of reframed that into it's really a pain problem, and it really goes into, why is there a need for people to use drugs? And people are self-medicating is really what it kind of boils down to, that they have a lot of pain, and it's probably really related to, a sense of loneliness and a sense of just not being connected. So between not having connections and the loneliness of that pain, and how do you resolve that if you're lonely and don't have connections? And self-medicating through some type of substance is one way to do that, to resolve that.
And then lastly, can you talk a little bit about some of the recent trends that you're seeing in terms of out-of-home placements as it pertains to?
Sure, yeah, that was one of the things that we mentioned, that we just had done some data crunching and discovered that out of 24 children who got placed out of a home, 18 of them were because of parents using methamphetamines. And that's a huge increase from previous years. And the trauma, the thing that we focus on is, the trauma of removing a child from the home and the impact of that, but also the trauma that impacts that family as well, the parents as well, and also the trauma with our workers. And part of that trauma for our workers is that we're also running short of placements. So when that happens, we start calling around for our limited foster parents, and we're really running even out of placements for children because there's so many of those. Fortunately, one of the things that we do is we focus a lot on trying to find other family members. So there's like a real focus in the state of Wisconsin of what's called kinship care. So you can try to find a family member that is willing to take the children in. So it lessens the trauma a bit because they are with family, they can keep the connections up. And there's some funding also, fortunately, that kind of goes along with that.